Hey there everyone, welcome to my channel. In the previous video we had studied about the anastomosis around the scapula, and in today's video we are starting the series of lower limb. So today is the first day of covering the lower limb. So this is the first video of lower limb in which I'll be explaining about the introduction. This is only the introductory part, and make sure to watch the video in 1.75x or 2x to save your time. So the questions will not be arising from this chapter in the final exams, but as we know that basics are important, so we are going to study the basics of this. So let's get started. So what does the lower limb help in? Lower limb helps in the weight transmission. It helps in the weight transmission because it is in the lower part of the body. It helps in the bipedal locomotion. Human beings have two legs by which they can easily walk and shift from one place to another, and provides support to the upper part of the body, the bones. It stabilizes the erect posture of the human beings, and the lower limb is bulkier and it is stronger than the upper limb. So the lower limb, it is not only bulkier but it is also stronger than the upper limb, as it contains more muscle mass and also has arteries, veins, nerves which are stronger than the upper limb. So what are the parts of lower limb? The upper limb, it is divided into the gluteal region that lies posterior and the sides, the thighs, the proximal part to the body, legs and foot. These are the distal parts of the body. Now, what is gluteal region? Gluteal region is a region that lies posterior to the body. So this is the gluteal region, and we will study the gluteal region in the upcoming chapters. So the bones that lie in the gluteal region are the hip bones. So there are total of 3 hip bones: ilium, ischium and its pubis, and these form together to form the acetabulum, where the head of the femur attaches to form a joint, to form the hip joint. Then the joint is the hip joint, as I already told. It is formed by the articulation of hip bone and the femur bone. Now we're going to talk about the thigh. Okay, the thigh extends from the hip to the knee joint. It is the portion that lies between the hips and the knee joint. So bones, the thigh that contains the bones are the femur bone and the patella. Patella is nothing but it is a sesamoid bone, and it is the largest sesamoid bone in the human body. Okay. Now talking about the joints that the thigh contains, it contains the knee joint. The upper limit is the gluteal fold, and the lower limit is the hams. Okay, the lower limit is the hamstrings and the upper limit is the gluteal fold. The thigh contains these things. Also, it contains the knee joint connecting the femur and the leg bones, that are tibia, the medial bone, and fibula, the lateral bone. Yes, now we are going to talk about the legs. So the leg lies between the knee joint and the ankle joint. Okay, as I've already told you that the bones that it contains is the medial bone, that is tibia, and the lateral bone, that is fibula. So joints, it contains 3 tibialo-fibular joints. Okay, remember this number. Just remember this number. It contains 3 tibialo-fibular joints. Okay, now coming to the foot. Upper surface, it is the dorsal surface. Okay, it is kind of complex because in the upper limb it was easier, but the upper surface of the foot is the dorsal surface, and the lower surface of the foot is called as the sole or the plantar surface of the foot. Okay, sole is homologous with the palm of the hand. Okay, it is homologous with the palm of the hand. So the bones that the foot contains is the 7 tarsals, 5 metacarpals and 14 phalanges. Okay, in the upper limb we have 8 carpal bones, we have 8 carpal bones, but in the lower limb we have 7 tarsals instead of 8 tarsals, because one of this bone becomes the patella bone, that is the kneecap. It forms the kneecap. So that is the reason we have 7 tarsals, 5 metatarsals, and 14 phalanges. 2 phalanges for the greater toe and 3 phalanges for the rest of it. So there are total of 31 bones that are present in each leg. Alright, so yes, okay, so the joints, it has 5 joints. The joints in the foot, that are 5 joints are there. So it is the transverse tarsal joint, tarso-metatarsal joint, inter metatarsal joint, metatarsalo-phalangeal joint, and interphalangeal joint. Okay, the tarsal joint, the tarso-metatarsal, okay, it is present between the metatarsals and the tarsals. The intermetatarsals, it is present in between 2 metatarsals. And the metatarsalo-phalangeal, it is present between the metatarsal and the phalangeal joint, and the interphalangeal joint, which is present in between the phalanges. So there are 5 types of joints that are present in the foot. Okay, now we will see the diagram here. Okay, so yes, we are going to see the diagram. This is called the hip, and this is the sacrum. It is made up of 5 bones, and also the this one. And then we have the hip joint. The hip joint is the articulation of this hip bone and articulation with the head of the humerus. This forms the hip joint. And this is the only bone that is the longest bone. This is the longest bone. It is called as the femur. That is the only bone that lies in the thigh. And this portion extending from here to here is the thigh, and from here to here is the leg. So this portion, the foldable portion of this lower limb, is called the knee. It consists of the patella, which is a sesamoid bone as discussed earlier, and the medial bone, that is tibula, and the lateral bone, that is fibula. And this is the ankle, where there will be articulation of the leg bones and the tarsals, and these are the tarsals, these are the metatarsals and the phalanges. So this portion is called the foot, and the portion that is beneath this is called the sole of the foot. Now we are going to talk about the weight transmission. So suppose if a person weighs 60 kgs, so it will be divided into equal parts, that is 30 kg to one leg and 30 kg to the another leg. And 15 kg will be transmitted to the ankle of the foot, and 15 will be given to the phalanges, in which 5 will be transmitted to the greater toe, and 2.5 kg each for each of the toes. So this is the stabilization of the weight or transmission of the weight of a particular human. So this is only for the person who is 60 kgs, and I want you to write what will be the weight transmission for a person who is only 40 kgs. So I want you to answer this now. The clinical anatomy, which is the most important. So intramuscular injections are given into the thighs, in the thigh region. So it is the places or the regions where these injections are given are different in the adults and in the children. So in the adults, it is given in the gluteus medius muscle, and in the children it is given in the vastus lateralis muscle. So this is a factual thing that everyone must remember. And then it is used to find the atrial pulse. It is a femoral pulse, popliteal pulse, posterior tubular pulse, and dorsalis pedis pulse. Now a very important topic, that important clinical anatomy that can be further seen or further discussed in the upcoming chapters, that is the superficial veins of the lower limb get enlarged. Okay, the condition where the superficial veins of the lower limb get enlarged or swollen due to prolonged standing is called as the varicose veins. Okay, and the examples for the people who deal with varicose veins due to prolonged standing are policemen, teachers, or salesmen who have to stand all day long can suffer from the varicose veins. Now, what are the peculiarities of the lower limb? It is the longest and heaviest bone, that is the femur. It is the longest and it is the heaviest bone of the whole body. Knee joint is very complex. The knee joint, it contains 12 bursa, so it is a very complex joint. And the longest muscle that lies in the lower limb, it is the sartorius muscle that lies in the lower limb. And then the largest muscle, this is the longest muscle. Make sure you don't get confused between the longest muscle and the largest muscle. So the largest muscle is the gluteus maximus muscle, under the cover of which a lot of muscles, veins, arteries and nerves, lymphatics are present under this cover. So it is the largest muscle which is covering the lower limb. The strongest tendon, that is the tendocancellarius, it is the strongest tendon. Now the thickest nerve is the sciatic nerve that passes below the piriform muscle that lies under the cover of the gluteus maximus muscle. Now the longest vein is the great sphenius vein, which is superficial and can be seen, and it is the longest vein. So the muscles with 4 heads. Okay, in the upper limb we have muscles with 2 heads, that is biceps muscle, and the muscle with 3 heads, that is the triceps muscle. But in the lower limb we also have a muscle that is made up of 4 heads, that is the quadriceps femoris muscle. And the biggest sesamoid bone, as I already mentioned, it is the patella bone that makes the kneecap. And the longest cutaneous nerve is the sphinous nerve. It is the longest cutaneous nerve, and the longest vein is the great sphenius vein. So this is about the lower limb introduction. This is the only introduction to the lower limb. It is not in detail, it is just the introduction. Thank you for watching.